Good evening, everybody. This is Anand here from Clinsav team, and we are going to in 1 minute. This is Anand from Clinsav team. I welcome you all to the Gyaan Vardhini session number 18. I'm Anand from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of the amazing Clinsav app that we have developed over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills fees, issue of refill letters, manage finances, and doing follow-ups with patients for any outstanding dues. Clinsav also sends automated appointment reminders 1 day in advance to your patients through SMS. And it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall start with today's webinar. Our today's webinar is Missing Link, Dental Examination in Ayurvedic and Modern Clinical Practice. Our distinguished speaker for today is Dr. Beatrice Deschamps. Dr. Beatrice is an Ayurveda Acharya from Sri Guru Mahavidyalaya of Gujarat Ayurvedic. She has 9+ years of experience as an Ayurveda Acharya. Dr. Beatrice has also done her yoga teacher training course from Kaivalya Dham. She has been a regular attendee of Tattva Prakashini programs, AVP Coimbatore from 2019 to 2023. In 2022, she co-authored the book Le Guide Familial de el Ayurveda with Perrin Morit and Mr. Alain Tardif. In 22-23, she participated in Therapeutic Approach of Yoga 1 and 2 by Mr. Sudesh Chand. Yoga and Ayurveda in France. Dr. Beatrice, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Beatrice Deschamps for today's session. Dear ma'am, you can start with your session now.
Thank you, Anand. Thank you so much. Thank you for the invitation. Thank you to Dr. Snehil and to Dr. Gala as well, who introduced me to this group, and to Pritika also. So I'm not forgetting anyone. So the subject of today will be the missing link in the dental examination, and especially in the global assessment of patient and the global examination in general, because this is something that we are not doing, I think. Am I right? Are you doing the dental examination? Do you examine the mouth of the patient when they are coming, if they are not complaining of anything or if they don't say anything? Everyone is silent. Yes, you do. No, we don't. So not everyone is.
Dr. Beatrice, I'll just help here with help you here. All the attendees are message.
They are muted, right?
You can respond back to Dr. Beatrice and your messages to Dr. Beatrice.
Okay, yeah, I can see the message.
Yes, ma'am, I can unmute them.
Yeah, also, yeah, they can. If they want to answer, yeah, they are free to answer, of course. Anyone else? No? It's not so often. I remember when I was interning.
No, I can. I've allowed mics to all the participants. So in case if if they want to talk directly, they can contribute.
Okay. So no one wants to say anything? I saw 2 answers already. Okay, so this is something that we are not doing much. If I remember properly, when I was internee and after when I visited many clinics.
Dr. Snail, would you want to comment?
Yes, Anand, it is difficult for me to unmute because I am sharing the screen. Coming back here,
Oh,
going there,
sorry.
it is difficult. I'm logging in from the mobile, so I'll comment from that side.
Yeah, please.
Yeah.
Sure. Thank you, Dr. Snail.
So we'll wait for him just a few seconds, no? So that he can he can share something. He has something to say, right?
So for a dental examination, I feel it is crucial even to understand the Prakruti of the
Sure,
patient, because the things which takes time to change are like eye color, teeth, of body structure that can give us the glimpse on the Prakriti of the patient. So it is not the that in within 1 month of the time denture will change or the structure of teeth will change, right? So it will give the understanding about the Prakriti, yes, one, and present doshas also. So sometimes that Pitta Prakriti's teeth are like very much sharp and very much cut out. So Kapha Prakriti patients are like well arranged and white and kind of things. Even we can understand the dhatus also from the teeth, and that we yes assess in our clinical practice.
That's nice then. This is the first time I'm hearing that. That's very nice. Yeah. And thank you for that, Snehil, actually. This is the point I wanted to underline, because this is something I hardly saw when I was internee, like you, or when I visited so many other clinics. And this is something which is very often missed. So what happened? Please, Snehil, next slide. Sorry. Thank you. So, as Snehil mentioned, this is something very essential. Actually, you will see in the slide ahead the main reason why, because it gives you, as the body, as the koshta, as the tongue, the state of the patient the day the patient is coming. And as I said, this is something which is very often forgotten, because very often what happens when someone is having a small actually pain, that person is not going to mention that pain. The person is coming for another complaint most of the time. So this is why you have to check and you have to ask very often for so many reasons. So, and you don't need actually to have the dentist tools for that. It's not necessary. Next slide, please. So you can see on the pictures here, but I think you have noticed most probably on patient, if you ever have seen, that you have different things that can develop if the teeth are not well, like asymmetric chewing, for example, that can lead to digestive issue, even to further issues, or you can have a low immunity, but then you're not understanding because the patient keeps on coming and complaining. This is how it will click your mind that maybe there is a link missing, and that link is in the mouth, for example. But you have so many other things. You can have recurrent tendinitis. You can have muscle breakage also. or tear of muscle that can happen. You can have heart disease as well. So many things can happen actually with the teeth issue or the gums issue. This is the reason why we have to assess that. Then plus there is another point that I found, that it's very difficult to break properly a Samprapti if you don't assess the mouth stages. For that reason, because you will treat something that you have find out inside the body, that you have assessed, the dosha, the dhatu, the mala, and the koshta, and then suddenly something is missing, which is a little bit more subtle. Because as I said, when a pain is starting in the mouth, or when an infection is starting in the mouth, it's not seen directly. But an infection can go to the bloodstream, to rasa rakta, and then circulate in the body and create some other problems. So if you treat just what you see, which is the outcome, then you're not treating the cause. Next slide. So we are going to go a little bit on the teeth side with a definition of the teeth. I know that all the things like that, we are going to do some practical cases just after. So the word teeth is danta in Sanskrit, and it's two words, dam and tan. So dam will be more like a tooth of animal, or it refers also to the tooth of the snake, the tusk and the fang, and then tan will be spreading or continuation of it. So we have different description in the Shastra that and it's all scattered actually. It's not in one place we have a full description, but somehow it's more or less not the same, I would say, but complementary to each other, because there are more description in Ashtanga Hridaya for the Dantaroga, for example, and in Shushruta than in Charak. So what is Danta? Danta is an asti, and we have 32 actually, according to the Shastra. Then we have the milk teeth, as we said, and then it gets replaced. This is described by Kashyap, essentially. And it's a Rujakasti for Shushruta Samhita that is also important. The measure of the teeth are 2 angula. So you have 1 angula, which is upper, that we can see, and you have 1 angula, which is the root of the teeth, that will see afterwards, which is covered by the gums most of the time. It's a Pitruj Bhav, so it comes from the maternal side. So the funny question would be like, because it comes from that paternal side, does it mean that if my father has bad teeth, I will have bad teeth as well? So it depends again. On Prakruti, it depends on your development, on so many things, but most probably it's an inheritage. So we don't have a long, detailed description of the teeth, actually, except in the Dirgayu, in Ashtanga Hridayam, essentially. And these are more like the teeth of Kapha Prakruti, as Snehil mentioned, and that we will see a little bit after, which are very wide, aligned, strong, and beautifully arranged and highly functional, I would say, that the animal is very strong and nothing happened to it. So I will not go again through the synonyms. I think you all know that, as you are not all doctor. So unless you need it, but the synonyms are just to say that to underline the functions of the teeth, actually, which are cutting, chewing, essentially, and grinding the food. These are the functions, mainly. Next slide. So the characteristic of the teeth, the danta is an upadatu of asti, that we know. And this is from Shushruta and from Sharangada Samhita, essentially. So what it means simply in a pragmatic way, I would say, that this is a deeper tissue to nourish, that it takes more time to nourish the teeth. This is what it means. So your asti should be in proper form, and then only the teeth will be properly nourished. As Snehil mentioned, it's not like in 1 month you will see some change. It will take more time for the teeth, actually. The elemental composition, it's, as you most probably know, mainly Prithvi and Vayu composition. And it will change a little bit. You can see on the teeth actually in the middle, which is a teeth cut in the middle of it. So you will see the density will be changing actually. The strongest enamel and the strongest part of Prithvi and Vayu will be outside, and then it will become softer inside. So they are very rigid, but we have to understand one thing: the roots actually are very mobile. I don't know if you have ever noticed the children, when you put the braces, they manage somehow to realign the teeth. So it means that our teeth are very strong, but at the same time they can move. And this is very important also. We'll see why afterwards. So the developmental aspect that I've talked a little bit, it's essentially according to Kashyap. So you will have the incisor, which will come first, and then the canine, and then the premolar, and then not the premolar, that's it. That will actually fall and will be replaced. And this is described by Kashyap in detail. The function I just mentioned just before, it's mastication, grinding, and cutting the food, essentially. This is very essential because that will send a signal to the stomach, actually, for the enzyme to be produced properly. So it's not only just cutting the things into pieces, but that is just a reminder from the physiology. So the Swarupa of the perfect actually dentition is really amazing because the texts are telling that the teeth sides are bigger than the average size. So it means very big teeth. They are well arranged and with strong gums as well. The mouth should be in a big size. They should be thick, firm also, because of course a teeth which is moving, it's going to be very difficult to grind something or to catch something, like an apple, for example, or something even thicker. Here in Europe, we have nuts. So if your teeth are not firm enough, then it's very difficult to catch these nuts and to grind them. They are smooth as well. As you've noticed, it's very interesting because the teeth are not like asti, they are not like our bones. They are different. Our bones are a little bit rough, I would say. And the teeth are very, very smooth, actually. And when you touch them, when they fall, if it ever happens to you. They are unctuous, so again, they are also very unctuous, that we can see on the pictures. And then they should be whitish. So again, you will have some differences according to Prakruti, because you will have very whitish. And for example, in India, I'm saying that it's a generality, I know, but you have very beautiful white teeth, which we're not having that much in Europe. Back in Europe, we have more yellowish teeth, or sometimes even grayish. That's very interesting. Next slide. Yeah. So this is the dental anatomy of the teeth. So that you know, but what is interesting in that is actually more the structure, which is becoming softer and softer. So the enamel is dominant in kapha structure, and it's very unctuous, I would say, because it's very unctuous and soft to touch. But it's also very hard. This is the hardest part of our body. It's supposed to be, at least. So we can raise a question right now, like, if it is the hardest part in the body, how come that something is happening to the teeth in the mouth? It's just a question. Then there is the dentine. The dentine is a little bit softer. So the composition of the dentine is 70% mineral salt, then 20% of organic substance, and 10% of water. So it's a little bit more, I would say, yeah. As you can see, actually, on the upper corner, actually, that teeth which is cut, it's really, really softer. So now it's a Gyaan and Prithvi dominant because Gyaan is more present. It was less present on the outer surface, which is the enamel. Then you have the cementum, which covers the tooth root, and that will be Prithvi Vayu mainly dominant, and that will have more sterotwa, maybe due to the form also. And then the tooth pulp, that will contain the nerves and the blood vessel, and that will be a Vayu Gyaan dominant, mainly, so Vat Kaph like structure. Next slide. Yeah, this is the type of the teeth. This is very interesting to see that the text actually had totally classified the teeth and given them names. So the incisor would be Rajadanta. So the incisor you can find here, there are 4 actually in the upper jaw and in the lower jaw. Then you have the canine, which are Vasta, which are on the side. So the canine are pointed, actually. They are really supposed to tear off the things more. They are more cutting. They have cutting edges even. They are pointed at the edge. The funny thing, if you look at them, is that they have single root. The only which will have double, even triple roots will be the molar. So they don't have exactly the same function when we are eating, and that you can mindfully realize that when we try to, I don't know the word in English actually, to grab something in the mouth, we start with the incisor. We take it with the incisor. We cannot do it otherwise. And when we need to really chew and grind the things, then that will be the premolar and the molar. Maybe that's why they have stronger roots, most probably even. So the premolar will be Darmstra, and then the molar will be called Hanayava. Yeah, Hanavya. And they have been identified in the same number. So that was just a classification to remind you that we have all of this in the mouth, and that, yes, they have different functions. Next slide. Yeah. Now the manifestation according to Prakruti, that will be different. I think you know also that, but this is also something we miss because nowadays all the children, they have braces, and so they get the teeth all aligned. So it's very difficult to assess. Actually, you can assess just when they have dental issue more. So the proper teeth which are going to be aligned and resistant with good enamel, and they will be very beautifully aligned naturally, will be the Kapha teeth. The Kapha Prakruti will have that. Most of the time, I would say. Then you have the Pitta type, which will be yellowish and medium size. This is the description from the Shastra every time. And this is also some practical things to notice. So, and they will have also a slight acidic pH, I would say. They have a tendency to have bleeding gums. And the teeth will be very sensitive. They will be, because of this acidic actually pH. So this is how I understood actually this amlatva from Pitta in the mouth of the Pitta Prakruti people. And then the Vata teeth will be totally uneven. They can be big, small. They will be totally messed out. they will be very prone to carie, of course. There will be less resistance also. And they can be weak, so they can break, or they can have so many other issues as we will see after. Next slide. So just by the smile actually of the patient, or just by opening the mouth already, you can see a lot of things with the teeth very easily. And even the smell also you can have, so you can have an idea. So in the SAR assessment of the Dhatu also, the dental examination is mentioned. In the Asti SAR, the Shukra SAR, the Meda SAR, and the Balance SAR, you can have description of the teeth. Actually, it's a little bit different in each of them, but it is present in those places. This is all the description we have about the teeth in Ayurveda, at least in the text. Next slide. Now the gums, it's also an important factor. We'll see afterwards also. So the gums will be a little bit different in composition, of course, because it will be more rakta and mamsa mixed together. And it's a fibrous vascular tissue, which is covered with a mucosal membrane, mainly. So you can see in the upper picture, the healthy gums, which are not swollen or not, they are clear in color, but not pale. And then you have the unhealthy gums, which are lower to compare, actually both, which are reddish and little bit swollen and a little bit retracted, little bit retracted, I would say. So again, you can have an indication if you just ask the person to open the mouth or just to smile, just to see, you know, to assess a little bit the gums and the teeth. So pale will be, and recessing, you know, with this periodontitis and this gums retracting issue will be more of vatic nature, I would say. And red and inflamed and bleedy will be more of pittage. And thick and spongy and well covered will be more of cuffage, I would say. And then you have to assess also if there are some spaces in the mouth, because when you have spaces in between the teeth or in the near the gums and stuff, of course, the food bacteria or the food debris can just stay there and create some issues also after. Next slide, please. So where the disorder of the teeth are present, so they are present in both, especially Shushrut and Charak. So I put for the reminder the two shlokas actually, but the Danta issue are clearly mentioned at those places. So as I said, when you want to treat actually the teeth, it takes time. But this is also something that should not be forgotten, because otherwise it will lead to further complication after. So you have some examples actually. These are just Indian example of what you can use actually for the disorder of the teeth. For example, again, I use different things because I'm in Europe, but that you will see in the coming slides. So here you have classical Trifala Gugulu, Yogaraj Gugulu, then of course Abhyanga, Sweden, Basti. And the pomegranate is also interesting for the gums and the teeth structures. You can use the Nimba also for the abscess, for example. It gives amazing results because it's antimicrobial, and then it will change the pH of the mouth. Then the Trifala Kashayam also is interesting because it's a Kashayam and because the taste is Kashaya, that will, how to say, create a totally different pH, of course, and that will create that sensation of how you call that when you hold something tightly. This is the sensation you have in the mouth when you use it. It's very, very interesting for swollen gums, for example. Next slide. Yeah. So for the disorder and the treating of the imbalance, then of course the assessment of the dosha, Dhatu, Agni, of course, which is, I think, missed in that slide. And the Koshta assessment is also important, but you have to assess the Shrota, as I mentioned in the beginning, because if it goes too deep and if you missed it out, then it can go to the blood circulation and then it can become a big problem actually for the person. Because just an example, a krumidanta, so a carie which is not treated, which will reach the root of the tooth, if it's still not treated, it goes to the bloodstream, as I said, and then it can create damage to the heart, for example. It's just an example, but it's a classical one. So the herbal remedy that you can use, so in India, mainly you have the gugulus. You have also the Rasna Saptak, Kashayam, which can be interested. You have Nimba, you have Babul and Mishwak, but this is more, I guess, for prevention, except the Nim. Because once it has gone too far, you have to go a step above that. Then you have the Tila Tailam also, but again, and the coconut, but this is more for India. We are more using the olive oil here, for example, because it's native from here, from France, at least. The avocado oil, for example, also. And then we are using some, this is for routine, but we are using also some plants. So we have the salvia, which you don't know, I think. It's a local plant. The oak tree. The oak is a very kashaya, very astringent, so we can use the bark and we can use the fruit also as a decoction. That's a possibility. And then the chamomilla. The chamomilla is very bitter, so we have some options, and we use the rosemary also, which is not written here, but you will see afterwards, because it has it's bitter and aromatic, and it has also other nervine properties which are interesting. So the therapies locally that you can use. The Kavala, it's a classical actually thing that I will use to help to change the pH with the food actually change of the patient. That is an important point. And then you can use the Abhyanga locally, and then the Abhyanga and the Basti. And the Basti will be very helpful, I think, in the long run to restore the proper actually balance of the body. Because as I said, Asti and the teeth are quite deep. So it requires sometimes some deeper therapies. It's more complex to put in practice in Europe, this one, especially the classical yoga basti, but still it's possible to do. And then you have to do, of course, the dietary and lifestyle modification, which are unavoidable actually for the patient, especially in those cases. Next slide. So the pain perception, I was talking a little bit about that, but for example, I think that you know also the VAT influence, if it's more, then the pain will be really drastic, and it will be cutting type of pain, all these things. If it's a pittage, it will be more with inflammation, and it will be very intense also. But if it's Kafach, for example, then you will have almost no or less pain, or maybe something very mild. So when an infection is there and then it spreads and and the person is not feeling it, it's very important actually to check the state of the mouth. That is the main reason why, as I said, because otherwise something can be missed. So next slide, please. Sorry. This is very interesting. This is preparing this webinar. I found this and I found this really amazing. Actually, I knew that there was a correlation between the teeth and the organ. I don't know if you're aware of that. So it's not from Ayurveda. I do regret it, but it's from Chinese medicine. So I think it's very interesting tool to use. I found that with some of my patients, it correlates and it's relevant, but not always. So that needs to be checked further. I'm telling very honestly this. So you can see that each teeth will be related to different organs in the body. So most probably when the teeth is affected, then there will be a problem in that organ. And when I said when the teeth is affected, it's not like just the teeth is, you know, totally rotten or there's some krumi that much that we have to remove it. Not only that, maybe just a little carie. If you have a little carie, then maybe there is a relation already with the concerned organs and the concerned glands also. That can, we'll see that after, actually, with the dental panoramics and the case study. Next slide. This is a bigger, I don't know if you can see can you see actually the table in a big way? Because it's very small from here. So this is exactly the same thing, actually. This is each teeth related to one organ. So if you're interested, I think this is something that the team can give you, because this is very interesting, actually, slide. And it's just the same thing that the round one. So it's in line only. So we'll see that after in the example. Next slide. Thank you. So without reading and without knowing anything, what can you understand from that and what can you deduce from this? It's a dental panoramic. I hope everyone has seen that. I think so. So what can you understand from this one? You guys can talk. No, you don't know? Okay. This dental panoramic is interesting because it's a lady who's 83 years. Yeah?
Yeah, Dr. Beatrice, we have got some updates in chat, like poor digestion.
Okay.
We have got an update from Dr. Hema. She says it's poor digestion. Dr. Praveen is saying implant. Dr. Pradipa says Asthi Kshaya. Dr. Chaheti has said no idea. So yeah, okay.
Thank you. Thank you so much. Yeah, because I don't have the chat actually in front, so I'm not saying sorry. Yeah, I see.
Yeah, so chat is allowed for participants. I just wanted to let you know.
It comes just now. It comes just now. So it was delay. Okay. Yeah, that's good. That's good. So the patient actually in this is in this Vat Pradhan actually age. This is the first thing. So obviously there will be some VAT issues. So you have different things. So the small screw that you can see, they are implants. So they are implants, so many actually. And then the one you can see, which are whiter, and where you can see the roots, these are the crowns, where the roots have been treated. And the one which is not treated on the upper jaw, it's a different thing. Actually, it's just false teeth, which is just what we call a bridge. I don't know if you have the same actually in India, in the Indian dentistry, but it's a bridge actually to fill up a gap. Yeah, the female get weaker. Yeah, I agree. Yeah. Astikshaya, yeah. For her, yeah, it's definitely and some of the teeth were related to the intestine, some other to the heart, to the lungs, to the stomach and liver. So I don't remember who said poor digestion, but yes, of course, poor digestion. And it might be very difficult for her actually to chew, because when you have those implants or those actually, how you call, crowns, it's more difficult to chew the food, because these teeth actually are not as strong as the real one. This is the challenge. Plus, this lady is, yeah, she's old. Yeah, that's good. Next one. Yeah. Okay, so now this one is different. It's a different case. It's a very interesting case also, because you can see the teeth are really nice and they are really nicely aligned in the panoramic, at least, and they are in good health. So this one, what can you understand without reading, of course?
That's a grossly decayed tooth.
A grossly decayed tooth?
Yes.
Where? In the circle?
Yes. And that undergone some root canal treatment also for.
There is no root canal treatment actually on this one. Not at all. She's
The tooth that is
totally
in circle
healthy.
only, no, you are asking.
Yeah, that circle one, actually, it's a fractured tooth.
Fractured, and also I think because of that vital portion, that's a gatapacha, that is called gatapacha, which was filled in its root portion.
Yeah, the root portion actually is broken. Yeah, the root
Yes.
portion is broken.
Yeah, grossly decayed.
So this has to be removed actually. This will
Yes.
not stay as it is. And this is the second molar. So again, that will concern most probably the intestine and the lungs, the large intestine and the lungs actually. And she's very young. She's 23 years old. So, but the teeth, the other teeth, they don't have any problem if you see. They are very healthy. They don't have even a carie or something.
The tooth that is adjacent to that one, that is having caries.
No, it's not actually.
Yes, in the radiograph, some sort of
Or I can
blackish
see
portion is there.
properly. Let me see in a bigger way. No, it's not having. Which
In
one?
its enamel. To your right.
To my right? No, I think
Yes.
it's the. No, I think it's the light. She doesn't have.
No,
It's
that's a
a
gap. That's a gap between the tooth, which you're talking
Yeah.
as that black thing. And probably the one behind the last molar that you have, probably that might have.
but that first molar
Mhm.
also on its mesial side. If you are a dentist, then you will understand that. On mesial side, just check with that once.
I don't know. I have in a very small actually motion here. So. But no, she's not having actually. She's not having just that fracture, actually, teeth, sorry, that can,
That tooth
that is causing
should be
problem.
removed.
Yeah, that should be removed, actually, and they had put an implant. Yeah, because this is what they are doing in Europe, actually.
There are 2 cavities also filled in the the number 1, 4th and 5th tooth. They both have cavities which have been filled, probably.
Which one?
Yes, exactly.
The upper left
Yeah.
or the that one,
Yeah,
or the
I
right
can.
one.
Yeah,
From the
okay,
Those
I
are
can
upper
see.
right,
Yeah.
first premolar and
Okay.
second premolar.
Yeah. Yeah, that's true. Yeah,
They
yeah,
were filled. Already they were filled.
yeah. They are filled,
Then
and
that
maybe
right
that
first molar.
actually.
I am saying about that first molar.
Okay.
That is to be filled on its
Okay.
mesial side.
It's still inside. Actually, it has not grown properly.
But that's like a caries bomb. Some
Hmm.
other time she might have pain, definitely.
Not in that case, actually. Maybe in future, but not in that case when I was given this. Next one. What about this one?
In this, that lower first molar having apical abscess adjacent to that missing space, and there is root stump also
Mm-hmm.
on the right
Yeah.
side. That is to be removed. And in the upper arch on the right side, that last molar to be removed. That is root stump.
Actually, it's not removed. It is this last molar has a problem. Yeah, that's true, and there is an abscess. That's true as well. But the other one, they are just capped actually with the
Okay.
crown. It's not like every time actually you see that on the screen. Actually, you
Is
have.
it that some teeth take time to grow due to the pitta prakruti, and that's the reason why there may be the non-uniformity between to the slight extent among the teeth? I'm not sure.
Actually, I think the deformity like that and the fact that it is not aligned properly is more due to that. Actually, this is more irregularity. The problem is in this panoramic, this dental panoramic, we cannot assess the how you call the whiteness or the yellowishness of the teeth. This is the thing. This is one thing that you can assess only when you see the person and you ask actually for the to show the teeth and the oral cavity. You cannot assess that with the dental panoramics. The dental panoramics will help you to see what is going on inside, what you cannot see with your eyes. That's it. But that's already of great help.
Dr. Beatrice,
Yeah.
can we infer that because they have damaged teeth, especially molars and premolars, the chewing would be a big issue? The food
Yeah.
will not be grinded properly, so definitely they will have small intestine and large intestine
Yeah.
issues,
Yeah.
and the quality of rasadhatu will not be great.
Yeah.
There would be a lot of kapha and vata increase, so probably the lungs and the heart would be affected.
Yeah, definitely. This is where I wanted to actually, this is where I wanted to go with that because this is what I assess in my own patients. So, and this is the main problem. Plus the fact that in that case, you can see that the molar in the right side is having an infection, which means that there is a low immunity, a low OJAS, of course, and there is alasia and all this tiredness and all these things due to the infection because the body is fighting against the infection of the root. This is why it's also important sometimes to have these kind of reports because then you can assess that there is a small pocket actually around the root of the teeth. plus the fact that the digestive, the GIT will be totally messed up. And this is how it's interesting also to correlate with the Chinese medicine actually charts, because it correlates exactly to that. This is the interesting part of it. Next one. Yeah. And this one, this is last example with the panoramic, the dental panoramic. Have you ever thought also about the implants? The
Because of
impact
this,
of,
I guess his
bonus is there.
Okay.
yeah,
Implant.
molar implant is there, yeah.
And on the right side, root infection is there.
Yeah,
Left molar, lower molar,
yeah.
that is to be removed.
Yeah, that is to be removed. Yeah, that's true. That is to be
Already
removed.
they did some post-in-code treatment also for that.
Yeah. And you know, it's very interesting because if you look at the Shastra, actually, they did not mention the root canal treatment, but they mentioned some lekan dravya and some pinda to put, you know, when there are such issues. So I guess they were not doing it the same way, but they were doing it in one way at that time also. So yeah, that should be removed and replaced. What about the implant? What do you think about the implants?
So
It's a
what I
shalya.
feel,
It's a shalya in the body, you know?
Yeah. So if we
I
have a
feel personally the first and the third molar, since they are damaged, they'll have to be removed, and because of which the person may have difficulty in chewing also, because the teeth have got slight irregularities. Hence, it may be tough to chew and digest food, because of which even many other organs in the body may be affected. Because if the digestive system does not work simultaneously, I'm sure the other systems like respiratory system and all may also get simultaneously affected because of this.
Yeah, definitely. Dr. Hima, you wanted to say something?
Yeah, if we consider implants as shalya, I feel any surgery, any surgical procedure that we do in our body, the implant is going to form a scar tissue and a fibrous tissue, which is going to tighten up the jaw. And I think that will pull up the fascia all the way from the jaw. And probably it would, in long run, I feel anybody who has an implant would have a disturbed sleep. And I have seen that in all the patients.
Yeah, that's why I was asking the question, because I was wondering. I saw that also in the patient, and it's a very well-known fact actually here also, but it's very difficult to find some research papers on that at present, I found. So
I have noted it down. Actually, I have noted it down mentally for all the patients who have had implants that they have disturbed sleep. And I feel it is because there is hampered blood circulation at the fibrous tissue that is being formed. So
yeah,
maybe you can put up all the cases together and then we club it.
yeah, that's what I was thinking, because it's very interesting actually, and that should be documented. At present, it's not documented at all. So yeah, and there is another thing also with the Crohn, but that you will see after in the other case. But I think you've noticed it also, because I'm also noticing all the cases I'm having, and I'm asking what they have exactly and where and all these things. So yeah, that would be good to gather all the information. Thank you. Next slide. Yeah. There is another thing also related to the gums. So I talked a little bit about it, but this is the parodontitis. So this is a retraction of the gums and the inflammation of the gums. And this is highly linked to the heart disease that I was telling. These are research paper from US that I found on the subject. This is also related to the brain, and the poor oral health can also contribute to Alzheimer's disease. So this is something that we have yeah, it was the chat, sorry. I was reading at the same time. So we have to take care also for the patient which are a little bit older, because when they develop some memory impairment or stuff like that, we have to check also the teeth health. I think this is important. And then the pancreas and endocrine system, and the diabetes also, because this is one thing that you have a lot more, I would say, in India, unfortunately. So this is also related to the teeth health, and I think to the mouth pH, because there is one issue also with the mouth pH, as I said, and for some people that needs to be corrected. Then there is some issue with the cardiovascular health, of course, the coronary heart disease, cerebrovascular disease, and peripheral vascular disease. So liver disease, of course, cancer, autoimmune disease, lung disease, kidney disease, and pregnancy complication. So at the end, that was interesting because I also discussed with the dentist in the clinic where I'm staying, and they were not really able to do the link because they did not document the cases, I think. This is the sad part of it. Mental care. I'll answer the question after, if you don't mind, because otherwise it will be difficult for me to finish. I wanted to show you the cases. Is it okay? Just remind me afterwards. Thank you. Next one. Okay, this is the first case. It's interesting because the Prakruti access was the calf vat Prakruti, so 1 meter 80 for 75 kg. And the complaint was not cholesterol, actually. The main complaint was tiredness. Really chronic tiredness, and he was sleeping very nicely, but he had bloating and tiredness after meal, and then it was like carrying that chronic tiredness every day to work. So cholesterol was there, and poor immunity, because he was catching cough and cold, whatever, very often, and that repeatedly, actually. So what happened with that patient? The health routine, the daily routine were quite poor because he was really stressed and he was not taking care of many things. So that had to be changed. And he was using a lot of transformed and preserved food, actually, every day. And even at the beginning, he was not even cooking vegetables. It's very classical, actually. Here back in Europe, you have people are very busy and they don't take the time actually to cook. So, and they will also not get the fresh things. They will get everything transformed, everything ready-made, because it's a practical way actually to eat, and they will eat in front of the screen and then finish after 5 minutes. So Agni was weak, he was not very hungry, and there was some probable malabsorption because the tongue was dented, actually. But not only, the tongue was coated, it was sticky, it was thick, it was whitish and grayish, especially on the back of the tongue, and the tongue was also bulky. The bowel movement was once a day and it was formed, but he was not satisfied and he was feeling that he was not emptying his bowel enough. So apparently, I thought at the beginning it's just, Agni and Koshta issue. That was my thought. And then he kept on complaining for a few months, like it was okay. And then he was coming back and then coming back. Until the day I asked him, I said, okay, do you have some teeth issue? Is there something going on actually with your teeth? Because I can see that the tongue is, the oral cavity is not properly maintained. There is something, and it keeps on going. And this is exactly what happened. I was really surprised actually when I asked him. So the people in in France, they are kind of shy. It's not easy to, you know, even to have the tongue. It's after 1 hour. It's not straight away, and then to assess the teeth and all these things, and they will not tell also because they don't have that habit. So he was having 5 crown, he said, in the molar and premolar, and then 2 were in replacement. And it was a 6-month actually process because the dentists take their time, as you know. And so it was in between. So he was not chewing properly. So I thought at the beginning it's because he's eating in front of the screen, but no, it was not that. It was partly that only. The problem actually was more coming from the work he had in the mouth. So he was having intermittent pain also on the teeth, and I was thinking that there was a shotoroda also there, and he was telling that yes, they are going to have the root canal treatment again because it got infected. And then I understood, yes, this is why it keeps on having so many things, so many issues. So the mouth pH also was not probably natural. That's what I was thinking because it was really sticky. So there was a need of a change because he took the habit when he came. Actually, I think it was the second time. He was very happy. He said, you know, I'm doing this gargle with the sesame oil, and this is very nice. And I said, no, I don't think this is, you know, proper for now. So we changed that. We changed with the Salvia Fanta. So the Salvia is a plant actually, which is having Kashai and Madur taste, both, and has a lot of, how to say, antiviral properties like that. So I asked him to gargle actually with that because that was easy to make also, and that was easily available. So I asked him to do that. And then I give him also that rosemary actually Fanta to have twice a day. That would help. The pachan, some pachan churna, as you can see, and then some triphala also in the evening for the bowel movement. And I totally changed actually the food, but I had to go slowly because here again, when you give too many things and too many change, they are not going to do it. They are going to do half only. So I introduced some change and said, okay, next time we're going to change this and this and this. And that improved a lot. And now he has to come next week to for the checkup. Actually, after the work also on the teeth is complete because it was also there. So the idea is to strengthen actually the teeth structure after that, after all that. But this case is showing you one thing, that if you don't assess actually the teeth, something is missing at the end. In that patient, it was totally true. Next slide, please. Yeah. So what happened actually when you have the Crohn already, and then you have a teeth infection? Why the teeth infection is happening? You remember when I was telling you about the teeth in brief, I was telling that the teeth are still mobile inside the mouth when we put the braces and everything. You can see that Crohn especially, she has moved. Like they put the cap, they did the root canal and everything, but they kept the root actually of the teeth. And they put the crown on it, but the crown has moved. And this is a mechanical stuff. You can't help. Once it has moved, the bacteria will come inside. You can't avoid to change it. And you can't avoid an infection. This is the thing. So most probably in India, you don't have that in everywhere. I think in Mumbai area that might be common. Most probably. Dr. Hima, I don't know. I think you have seen such cases, right?
Yeah.
Yeah. And this become a challenge actually, because you have to, and I'm telling you in a very frank way, you have to save actually the teeth of the patient before he has that. Once he has that, this will be problems only, because that will move at one point. That you also have to check. But you have to save actually the capital before that. So this is the important part of it. And you see another dental panorama where there are some, again, some crowns which are placed and some, and it's a very different one again. But this is very frequent for the people who live in the city. Next one, please. This case is very interesting. It's a 60 years old lady. She's 1.65 m, something like that. 55 kilos. She's very thin and she has a kyphosis by birth. So already she's not sitting straight, mainly Vat Pit in Prakruti, I would say. And she came actually, it's a regular patient. And then she came that time and she had finger joint pain and burning sensation, like acid spread inside the finger and the arm. So, and she came in December, something like that. So, yeah, what is important to notice, so the CRP was up, and what is important to notice at that time period and last year, we had a lot of rain, even in summer. It was just continuously raining in France, like very less sun, very less warm and hot temperatures. So she came after some, yeah, in December. So after 2-3 months of rain, continuous rain, something like that. So poor immunity was there. Stress was very high. And then again, she was not having appetite and bowel movement very loose. This time she had 2 bowel movement per day and very loose stool. And the tongue was slightly coated gray, yellowish, and swollen also. But a little bit more dry this time. So apparently I thought at the beginning, okay, it's a form of Vataracta or something. And then I realized that last time when she came, she mentioned to me that she has gone to the dentist for some work. So I asked her actually if the work from the dentist was completed or not. From 1 year, it was not completed, and she had 2 actually gap, one in the lower jaw, the first molar, and one in the upper jaw. So she could not chew properly. It was difficult for her, and most probably some, yeah, the tongue was dry, but the saliva was there anyway, and I suspect that she was having some acidic taste in the mouth, because this is not the first time actually. Every time I see her tongue, there is something, and the teeth are really yellowish in her case. So once it was identified that it was from the teeth, what I did is I did some Trifla Kashayam actually, morning and evening, and also after food, to change the pH, because I thought that would be the best way actually for her to do, and that will strengthen a little bit the mouth environment. And then morning empty stomach, I gave her that Gentiana officinalis, which is a very bitter drug. But it's very bitter, but it's not, we have some bitter drugs which are like, I don't know how to say, very ruksha. This one is not ruksha. It's a snigdha drug. It's very unctuous at the same time. And then I put her on Sansarjan Krama. You know exactly what we do after the Panchakarma. Because I thought, okay, it's not going to be enough. We have to start everything from zero. And here in France, I'm not able to give any panchakarma anyway. So usually I start with that option, and that works very nicely actually. And I gave her a mix of cumin, coriander, fennel in equal part after food. That was it. And after 2 weeks, the complaint actually totally reduced and stopped. So that was a very nice actually thing with her. I think still the teeth are on process, and till now she has not come back. So, but I know she's well because she sent me the message. She's getting better. So that's also very interesting, because I never thought actually that the teeth issue and the teeth work could lead to such an ailment. I mean, I was the first one surprised with this case. Next one. Ah, there is a blank. No, it's okay. Okay, this case actually, it's a female as well, 48 years old, 1 meter 68, 70 kilos, so slight overweight, dominant calf, but in Prakruti, she has a very sedentary activity. And she had pain in the large intestine and abdominal distension. She mentioned 7 out of 10, because sometimes I ask them to mark the points to graduate actually the disturbance or the pain. She was sensitive to noise and light, and she has gluten and lactose intolerance. So liver index was up, and there was a Prithvi actually sound from the liver on percussion also, so I mentioned it. She complained from memory loss as well, and chronic tiredness, 7 on 10. So she has taken 1 month after I examined and everything. Then suddenly I thought about asking about her teeth and her teeth health, and to show me. And then she mentioned that she had to be taking 1 month antibiotics due to dental abscess, and teeth were uneven and yellowish. So Agni was weak, and the bowel movement were green and yellow and sometimes unformed also. So the tongue was coated, yellow, bulky, and inflamed and dry. So she is taking 1 or 2 liters of chicory. I don't know if you know what is chicory. Chicory is a substitute for coffee here. It doesn't contain caffeine, and it's the root of a plant, which is very bitter. But how to say? The root is like, what example can I give you? It's very snigda actually, and it's like how you call that psyllium you're having, isabgol. It's like isabgol, but it's bigger. But it has the same effect actually. It just has that effect that the person will go and pass the bowel movement and have gas. This is what's happening. Plus, it will. This is something that we should be very careful to if we give to the diabetic people also, because it can provoke also hypoglycemia. So it has hypoglycemic effect. It's very common back in Europe, actually. People drink either chicory, either a mix of chicory and coffee together to avoid to have too much coffee. So she was having too much actually during the day. And then she was having for the meal rice, pasta, and then fish. Essentially, that's what she mentioned. So several dental replacement over the past 3 years, plus the antibiotics also. So no proper chewing, the food was there. Mostly she was swallowing. This is my guess, because when I asked her, she said, no, I'm chewing properly. And I was like, I had one question mark, especially because she had an abscess. So The mouth pH also, I was really wondering, because what happened with the chicory, when you drink it, you have a taste actually in the mouth after. And this is not the taste of the bitterness. It's, I don't know how to explain. It's a coating thing, and it coats the tongue also in yellow color. So I thought it was mainly partly due to that, due to the fact that she was drinking too much of chicory, but not only. So I gave her the Kavala with the Triphala Kashayam to restore the pH. And the mix of cumin, coriander, fennel, and ginger and pepper after food this time. The Chardon Marie, it's another plant that we are having. It's bitter, but this time it's very ruksha. So I gave her for 3 weeks, and then I gave Guduchi also. And then I changed totally the structure of the meals because I wanted her to, yeah, I did not mention, but she's eating chocolate. So to avoid actually the pasta and the chocolate and to reduce the chicory and to avoid the curd also at night and to avoid the raw food, to take easy food to chew actually. And then again, I have to see her after some time. So that was also interesting because when she came, I did not suspect it, just seeing her like that and assessing her complaint, that that would be linked to the dental issue that she was having. And most probably the, how you call, the bacteria in the gut are also disturbed due to the antibiotic she took. Most probably, I think. Next one, please. Yeah, this is still this one. Yeah. This one is case number 4. This is a 47 years old woman, 1 meter 70, 56 kg, something like that. Dominant vat pit in Prakruti, burnout in July, breakage of calf muscle, hair falling, overwork more than one capacity, and skipping meals for a week. So Agni is good, strong, with bowel movement once or twice a day. Vegetarian diet was there also. The tongue was swollen and the coating was mild with thin grayish coating. There was no other complaint except, sorry, scanty menses. And the teeth are messed up, yellowish. The mouth pH is very acidic. And that person cannot bear actually the acidic taste. So the gums were swollen and with abscess. So there were 3 dental crowns in the mouth and sometimes mild pain and suddenly drastic sudden pain from the lower jaw. So yeah, acidic taste and yellow teeth, that I've said. So once identified, then there was Kavala after the food, of course, with the Trifla Kashayam. And in the morning also, so morning, evening, of course, with the teeth brushing, but also after the food to restore the pH. And then at one point, there was a pinda done with the pipali, nimba, ginger, and honey on the gum to reduce the enema. And it worked very nicely. Morning anti-stomach for 2 months, tiktagrotam, actually, and mamsarasa was also added to the diet for 6 months. Plus some pachan after the meals, which was hingu vachadi churna in ghee. So that gave also very nice result. Next slide, please. You will see the, yeah, the dental panoramic actually. Can you assess which one of the teeth actually was infected? Tricky question. No? I can see the chat actually. It's not, yeah. This is I can see. Let me see the chat. Upper left molar. No, it's not upper.
Hi, everybody. You can directly unmute
Yeah, you
your
can unmute yourself
mic
and answer, no
to
problem.
answer the question.
Left molar. No, it's not left molar on that one. It's the right one. There was only one left. So it's the right one, actually. You can see on the picture, it's very small for me. So, but you can see the tip of the roots. Actually, it's not clear properly. And you can see it's a little bit dizzy. The image is a little bit dizzy. And this means that there is a huge infection. This infection was present 3 years back, actually. And it was in germ and it growed. So it's very clear on that panoramic, that dental panoramic. So this is another issue when you have patient going to the dentist, actually, they go for root canal treatment. Then maybe there is a chance after that, maybe the root canal is not done until the end. And maybe there is a chance of infection also. Because this is one thing also to keep in mind. Next slide, please. Okay, this is the case number 5. Then I think this is the last one. Yeah, this is another lady. She's home wife and she's overweight, as you can see, because she's 116 kgs. The Prakruti is Kapha Vat mainly. She was very imbalanced emotionally, overweight, inflammation, and slight ulceration of the rectum, itching and pricking. The inflammation of the rectum actually and was and the anus was taken care by the mother that I have to mention because she chose that option. So there was an abdominal distension, 2+, I would say maybe something like 5 to 6 over 10. And then her Agni was erratic. She was hungry in evening only. And she was having a, how you call, yeah, a snack, a huge snack at 5. And then again, dinner at something like 7. The bowel movement, 1 time to 4 times. Depending on what she was eating and the emotional state in what she was staying actually, and she could not hold actually the stool. She had to rush to the toilet. She could not stay. So what she was eating mainly eggs, raw vegetables, small quantity of food, coconut oil for cooking, and then eating only the leftovers. No red meat, no fish. But she was cooking for the whole family, and she was telling me that I wanted to go fast, so I don't want to prepare anything for myself. So she was just eating whatever was left or whatever she could cook easily. For the snack, she was having biscuits and sweets items. The tongue was large, red, and she was inflamed. It was a dry tongue with a lots of cracks. Actually, she's in premenopause. She has 2 children, and the teeth. She mentioned, because again I asked her. I was really curious, especially in that case, to ask her if she was having some dental issue, and then she mentioned that the whole right part of the mouth was totally replaced from canine to molar, actually on both sides. And she was having very nice actually dentition, very, very nice aligned teeth. She never mentioned that she had put braces or something. And very clean, very white, very much kapha teeth. Really, very, very nice. So she was not chewing properly and she is not having proper lifestyle because she's staying at home and she's sitting after food also. And just being a little bit lazy because she's tired of doing the homeworks. So these teeth, as I showed you in the diagram, actually you have the molar, some of them are related to the rectum and to the large intestine. So that was not a surprise. When she came and she mentioned that, then I was thinking about the chart and I thought, yes, this time it's a good correlation actually for her. For now, the idea is to prepare the food freshly cooked on daily basis. This is the first thing. Mainly bitter, astringent taste and cold in potency also. And avoiding the snack actually at 5 p.m., which is a little bit difficult. To take the time actually to sit and to chew the food, because that also she's not doing, because she thinks that eating is a waste of time and that her body doesn't accept the food properly. So mainly that was that, and I give some churna also to help for the digestion for this time, because she will have to come again. She was in such a state that I had to manage kind of slowly. I thought that, and she even told me, she said, if you give me too many things to do, I'm not going to do it at all. So I just sent her also for a walk after the food, and we'll stay after some time. This is the first step actually with her, but this is very interesting because we can see how the teeth issue and the the chewing issue is there in those few cases. I'm sure there are some more. I'm pretty sure if I'm looking in the cases I'm having, but yeah, that, as Dr. Ima said, that needs to be documented more. Please, next one. So shall we integrate the dental assessment in Ayurvedic practice? This is the question. That was the tricky question for the end. I think we should actually. Not only we should, but we must in each patient, so that we are not missing a huge point in what we are doing. This is the key word, I would say. And we have to find also holistic approach and treat the mouth, because most of the time there are some things to correct also in that area before nourishing ST. Correcting the digestion, okay, yes, it's one thing, but at times it's not enough. This is what I could also see with those patients. Do you have any question? Yeah, I think I'm over time. Thank you, Snehil. Thank you for your attention. And if you have question, I think there was a question in the chat box, right?
Yeah.
Yeah. I hope it was not too
Thanks a lot,
boring for you
Prakruti,
guys.
for that insightful and enriching presentation. Your expertise. I think it was really very interesting. Thanks again. Your expertise and knowledge have helped us with deeper understanding on how this topic can be helpful to all the doctors present here.
I hope so.
Before we conclude, I would like to open the floor for any questions. And please feel free to raise your hands or type your question in the chat box, and Dr. Beatrice will address them. The Q&A is going to be hosted and managed by Dr. Snehil Makwana.
Yes, good evening, everyone. Very powerful, meaningful, and knowledgeable session, Dr. Ma'am. One thing I want to add is, above all what you are using, one more thing which we add in our treatment for the dental issues we find is the nasya. So you must be familiar with that, as we are the student of Gala sir. We will not miss the Nasya.
Yeah,
And
definitely.
with good Shunti Nasya. And after that, depending on the condition, to improve the structure, improve the dhatus, improve the strength of the jaw, of the inner, all the elements, we use different nasyas. And one more thing I would add is using of eardrops, that is Karnapuran, for the jaw. So we have been seen a cases where the jaw is locked acutely, and putting the Karnapuran, it just unlocks the jaw. So for long run, for the oral health, dental health, and health of the mandible, which is the main moving bone in the chewing, we use Karnapuran also. But Nasya and Karnapuran, yes, we would like to.
That's great. Yeah. Yeah, Nasya, yeah, I'm using sometimes. In those cases, I did not use, but yeah, I'm also using.
Yes.
Thank you for
Moving
the
towards
reminder.
the questions, I have to search in the chat if anyone has
There
the
is one
question.
question I found, I think, there from Mukta. What is the treatment for wisdom tooth, which is partially covered by gums and not properly come outside? I think there is something mentioned in Kashyap. I don't have it by heart, to be very frank. But I think you have something in Kashyap for that. And after, it depends if it bother actually the person or not. Because if it's not, how to say, if it's not bothering the person, I would say let it be, because you are going to, if you want to force actually that teeth to come, that will create another disequilibrium. So that you have to manage.
Yes. One question is from Dr. Anita. Can the implants also cause mental, emotional issues due to the various disturbances?
Maybe, most probably, but as we said with Dr. Hima, that should be documented. I'm not a dentist, so I cannot answer. So I will give you wrong answer, I would say. Mental issues, I would be very frank with you. Nowadays, I see much more. And from everybody, I would say, here. People have a lot of stress. I think this is the same for you on your side. I remember that Mumbai is not so different from Paris for many things. So stress, pressure, and yeah. So mental imbalances are more, and there will be more and more because of the social medias also, I believe strongly. So it's a possibility. This is what I can answer. Maybe Dr. Hima, Dr. Snehil, they have a better answer for that. Maybe they know. Most probably they know.
Next question is from Dr. Praveen. If grinding of food is important, what about in the children before molar teeth grows? Is there any other thing?
Is there any other thing for whom? For the children or for the adults?
Praveen, Dr. Praveen, can you, if you can unmute yourself and ask the question? Yes, we understood that earlier part of the question, that grinding is important, but in children, they don't have the molar teeth in the earlier phase. So what is the question about that? Can you, if you can unmute yourself and ask?
Yeah, my question was just before in a childhood, you can say in 0 to 2 years, they don't suffer much if you take care of other things. They don't get that large intestine, small intestine, or those problems. So there may be something other thing behind which can be kept for older people also.
They are not in the same stage of life. This is the first thing. They are protected by the kapha dosha. This is what I would say. And then the second thing is they don't eat exactly the same thing. But if you look at it actually in the Shastra, they said that we have to give them gradually the things to the children. So And maybe also, this is one question I'm wondering even, you know, because this is triggering another question. Maybe the milk teeth are more solid even. I'm not sure, but maybe in some of them.
Okay,
And
so what?
the Agni is not weak also. I think that is that the Agni is not weak in them. But in the older people, the Agni is weak and the structure is already damaged. That might be the reason why it's more complicated and more difficult. But I think naturally we will give them both, actually, the children and because I'm just trying to think what I give actually to the children and stuff. I will not give them hard stuff. Naturally, I will not do that. And same way with the older people. You will give them things which are very easily digestible.
Okay. One last question is from Bhumika. In allopathy, dentists suggest removal of wisdom tooth. Could you tell what are the ill effects of removing them?
There will be some effect, I think, first on the jaw and on the process of chewing and on the digestion. Depends what person you have in front of you. Like if there is a person with a mandagni and you remove these 4 tooth, then that will become more difficult, I guess. Then there is another aspect you have to see with the organs also, I think. It's a very interesting question, actually. If you have a link with the organs, you have a link, actually, according to the charts, with the big intestine and then the lungs. So see if those persons are starting to have issue, because this is not one teeth, it's 4 tooth. See what are the problems that person is encountering after in life. There must be an impact. There must be an impact. If we have 32 tooth in the mouth, this is for a reason. They should not be removed. They are useful. Each and everything is useful. It's not without consequences. When they put the braces, actually, to realign the teeth also, they remove, I think it's the first molar. I'm not sure. But I think this is what they are doing. So you imagine 4 last molar removed, and then the first molar also removed because of the braces. That becomes complicated. So, okay, it's beautiful, but what is the use of being beautiful if it's not useful? And if it's not functional for the body?
True, very true. Yes. So last addition is like as Dr. Praveen has said about the children. What I tell my patients who are with the children, they come and they say, as the child has turned 6 months, we have to start the food. That is the meaning of idea in the allopathy, that 6 months are completed, then you have to start the food. Yeah. But what I see is each and every child develops teeth at different ages. That is the indication of the body that now the gut is ready to inculcate the solid or semi-solid food. So whenever the child is ready to eat the food or chew the food or grind the food, that time only the molars will come up, and at that time the food has to be inculcated in the chart or in the diet of that child. So that is the clear indication from the body itself, from the different child and different age. So accordingly, whenever that molar is coming up, then only that solid food which has to be chewed properly has to be introduced in the child's diet. That's what we suggest.
Yeah, that's very obvious, actually. That's a very obvious answer. Thank you for that.
Yes. And last question is from the Bhumika. Does Kashai Ras drug interrupt the pH of saliva?
For some time at least, it works. Yeah, it works, but you have to change the food also, because if you don't change the food and the person keeps on getting some very acidic or sour food or salty food, there is no use. I would say it's a waste. It's horrible to say, but... And we have a lot of acidic food actually over here. So it's a challenge.
Yes. Okay. Mostly we are done with the question and answers. Anand, you can take over now from here.
Yeah, thanks a lot, Dr. Snehil, and thank you, Dr. Beatrice.
Thank you for
So we are going
inviting me.
to, I'm just going to close the session with some closing notes. Thanks a lot to all the participants in for this webinar, for your active participation and engaging questions as well. We hope you found this session very valuable and informative. Once again, a big thanks to Dr. Beatrice Deschamps for sharing her expertise with us today. And thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session, which is scheduled on 25th of June to be conducted by Dr. Shilpa Dhoka. The topic is back remedies and its benefits. I've also shared our spam-free Gyaan Vardhini WhatsApp community group link. Please join this link for our regular updates. And I've also shared our YouTube channel link. If you are interested, you can follow this link. Thanks a lot, everybody, and wish you all have a wonderful evening.
Thank you.
So closing the session
Thank
now.
you all.
Thank you. Have a great day and a good evening.
Good evening. Thank you.